You ready?
Hello, good evening, everyone. I want to thank everyone for coming out this evening to our Go Red event, Black Girl Magic Shop. My name is Tiffany Andrews, and here we have Dr. Seabrook, Community Health Net Center doctor. So I wanted to have a Go Red event to bring heart disease awareness in our community, party with a purpose. I do a lot of events, but we're going to start partying with the purpose 2020 and beyond. So we have Dr. Seabrook here to give us some information on heart health and her good recipes. I got a soul food recipe. And so we're here at the new Dialogue, 601 South Lake Street. This is a beautiful venue if you have any meetings for your groups, small groups. This is a perfect place. Wine, books, conversation, dialogue. So that's why we're here today. So I want to turn it over to Dr. Seabrook.
So thank you so much. Thank you so much, Tiffany, and thank you all for the invitation, and thank you for your attention and coming out tonight. It's really been a treat and a pleasure to be here. You guys have to come. It's called Dialogue. It's 601 Lake Street in the Miller section of Gary. It is great. The atmosphere is great. Inside is beautiful. They have wine, red wine, heart health. Remember that. And they have books. And you guys know I love to read. So we're here tonight to talk a little bit about heart health, especially in the African American community. We really have to take better care of ourselves. And it's so wonderful tonight to see so many people here with their red on in support of February being American Heart Association Month. So you all should give yourselves a round of applause for being here tonight. So in the United States, heart disease is the #1 killer of Americans. However, it is the #1 killer of African Americans, and we are 49%. African American females are 49% of the deaths due to heart disease in the United States. And so it's very important that we make sure that we're taking care of our heart the best way that we can. And many people say, well, how can I do that? You know, how can I take care of my heart? Well, one of the things that you can do to take care of your heart is to make sure that you're keeping your blood pressure controlled. And you control your blood pressure. One of the ways to control your blood pressure is to reduce the amount of salt that we take in our diet every day. We put too much salt on our food. We eat prepared foods, packaged foods that we pop in the microwave because we're so busy. If you turn back and look at that label, you would not do that, because typically what happens, that little package doesn't even fill you up. So what do? You go and get another one to actually get full. So you've had more than the daily recommended amount of sodium for the day. And so that causes us to swell. We retain water. Our heart has to work harder to pump those fluids around. And then next thing you know, we have this thing called congestive heart failure. So then we have to be placed on medications to help remove the fluids from our body and to help reduce our blood pressure. So what I'm asking people is to think about those things that we do on a daily basis that can help us take better care of ourselves. So decreasing our sodium or our salt intake every day, increasing the amount of water we take in, and how about doing a little bit of exercise? And all of that has to be is walking. It could be as simple as walking. It doesn't have to be this labor-intensive cardio 45-minute workout. If you're new to being more active, you can start out with walking. But we do encourage you to get 30 to 45 minutes of exercise a day.
Now that's starting out.
It's called brisk walking.
Okay.
And you work yourself into exercising. And you know what? We're laughing and joking, but we like to eat, right?
Yeah.
We love to eat, especially on Sundays. Well, actually the whole weekend. But we're sedentary a lot. We're more sedentary than we are active. So it's good to be a little more active than we are, and that helps us in our overall daily health, in our intake. So I'm going to keep it very brief, but if you guys have any questions, you can ask any questions that you might have, and I'll be happy to answer them. I spoke about the number of, the percentage of African American women who die of heart disease a year. Well, the men are not too far behind us. They're at 42%. Our Caucasian counterparts are at 37% for the men and 32% for the women. So we need to get our acts together, because when you look at 49% of all the deaths in African American women that occur in 1 year, 49% of those deaths are due to heart disease. So we really need to look at starting to take better care of ourselves. When you think about it, typically, the mom is the one, or grandma, that's going to the grocery store and making all of the purchases. So that healthy heart atmosphere starts at home. And hopefully we can gradually take those things out into the community, maybe when we're going to restaurants and things like that. And I'm smiling because it's not easy when you go out to restaurants and you're looking at that huge menu trying to decide, what's good for you and what you should or should not. You don't want to go to a nice fancy restaurant your first time there and just order a salad. Okay, who wants to do that, right? Nobody. But we need to just think smarter about the things that we are ordering and those choices on the menu. And you can't ask for them to not include salt when they're making your food or preparing your food. So just some things for you to think about. So we're going to increase our water intake. We're going to reduce our sodium intake, and we're going to get up and start moving, right?
Right.
Okay.
45 minutes?
45 minutes a day.
Easy,
Can
Doc.
I do like 9 times 5 minutes?
Yeah, you can, Jay. Just for you can do that.
You need short intervals.
You can do stretches, anything. You need to get your heart rate up over 110, okay, 120 beats per minute. You need to get your heart rate up. Okay, you need to work up a sweat. Put some braids in so you don't have to worry about your hair going on.
Okay. Worry about those flips messing up.
Protective styles.
But have the conversations with your primary care provider. Be real, take your blood pressure seriously if you do have elevated blood pressure or moderately elevated blood pressure, or they tell you that you're borderline. Take that seriously. There are small changes that you can make when your blood pressure is moderately elevated that could help reduce your blood pressure just by making small dietary changes. And the first one is with reducing the amount of salt. And you'd be surprised. And your clothes will start to be a little looser too, because that water starts to come off. And then you start to lose weight as you're starting to get more active. And people think that, well, if I'm drinking so much water, then the water isn't going to go anywhere. But you'll naturally diurese and release that water when you start to reduce the amount of sodium that you're taking into your body. Okay? Does anybody have any questions?
I have a question.
Sure.
A lot of people think that because you take blood pressure pills and cholesterol pills, that it's okay to eat anything that you want. Is it okay?
That's not okay. That's a great question. So thank you for asking. Because you also have patients or people who will say, well, I'm going to drink a beer tonight or a glass of wine, so I'm going to skip my medication. That is not the way to do it. So you can't just eat anything. Those medications work in concert or conjunction with you making those healthy lifestyle changes. So if you're still going to continue to eat high cholesterol foods and to eat salty foods, that blood pressure medicine and that cholesterol medication are just going to be a drop in the bucket, and they're going to be fighting against a losing battle because you're still ingesting or doing those bad habits that you had. So the medication is like, okay, I give up, So that's not a good thing to do. If you're going to take a medication to reduce your blood pressure, to be more effective, you need to also do those things that you need to do to assist the blood pressure medication, which is reducing your sodium intake.
I have a question, Dr. Seabrook.
Sure.
When you have heart conditions that run in your family, I have a friend they have sisters, brothers, everybody has like some type of heart condition. How do we, or what do you recommend as a routine or regimen to get checkups to find out if that runs in your family? And if it does, what's the frequency that you need to go and kind of get that monitored to just be on the safe side if you know it's hereditary?
Okay, so one of the things that I would recommend to everybody in this room, if you don't have one, to get a primary care physician, okay? And that can be a family medicine physician, like myself and my husband, Dr. Isa, or it can be an internal medicine physician. And so they specialize, well, we do everything from adults to children, but internal medicine specializes in adult and takes care of adult medicine. If you have a primary care doctor, the one thing that is most important, which most people don't do, is they don't share everything with their doctor. Mm-hmm. So you need to share your family's medical history along with your medical history to that healthcare provider, to that doctor. So then they can make a determination as to next steps for you based on your body type and based on your genetics and things like that. They'll be able to tell you if there's certain tests, blood tests, or certain other tests that they may need, diagnostic tests that they may need to do. But the first thing is coming in and seeing your physician and getting a complete physical, but then also sharing your medical history, what has happened to you in the past medically, and then those things that you know historically that have been going on in your family. And that's how you start. And then the doctor will put together a plan of action for your care. Because some people are at lower risk, even though their family genetics or dynamics may be going one way, than someone else in the family. Mm-hmm. So that's why it has to be individualized and tailored to the individual patient.
One last question. This is just for all of us and for those who are watching. What are some of our risks and habits that make us candidates for heart attacks? I have a cousin by marriage who collapsed over this week. He's 51, heart attack.
So within the last couple of years, my husband and I have experienced, not witnessed personally with our patients, but we have personally known and heard of people between the ages of 35 to 55 who have been having myocardial infarctions or heart attacks just at work or at home and collapsed, and it's called sudden death syndrome. So one of the things that we can, first thing is to know the signs and symptoms. And women, we have different signs and symptoms, not like the normal arm pain that a man may have, or the crushing chest pain like an elephant is sitting on your chest. Ladies have strange pains. I had a church member, and she was complaining of tummy pain while we were in church one Sunday, and I took her out into the hallway and we were talking. She started to get a little sweaty, and I said, I think we need to call 911. And she said, but it's just my tummy. And I said, well, you have a history of heart disease, so let's make sure. Ambulance came and picked her up, and next thing you know, they were calling me from the hospital and said they were taking her to surgery.
Wow.
Because of blockages. So ladies our symptoms are different. We get tummy pain sometimes, we get back pain between the shoulder blades, and we get jaw pain when we think we're having a toothache. Those are some of the signs that ladies get.
No idea.
It's not the typical signs that you normally hear of when someone is having a heart attack. But because we're having such, it's almost like a rash right now of young men in particular, from 35 and that 55 range, collapsing of heart disease. What it stems from is from the things that they did in their early life. The fried foods, the fatty foods. I mean, you have some people that will eat fried foods almost every day if they have the opportunity to. So we think about the things that we take in, and the things that we do in our youth eventually catch up with us. And I think that that's what's happening to these 35 to 55 year olds. The things that they did in their youth are starting to catch up with them.
Okay.
Where can we find you and catch up with you?
So I'm on Facebook.
Everybody should be following you tonight. Yes.
Dr. Janet Seabrook, and then I'm also on Instagram, and James has me on LinkedIn and
Twitter.
Just go to your website.
Yeah, just
Right.
go to my website, drjanetseabrook.com, for more information, and healthy recipes are on the website as well. So I thank you all. I hope that you have gained some little nuggets of information that you can either take to heart for yourself or make sure that you're spreading the information to your family members. So thank you all so much, and thank you,